Hello, I'm Timothu. Um, Today I am going to discuss a past paper with you, a past paper of professionalism and issues of nursing. Actually, this is 2017 May semester paper. So we'll discuss one by one. The first question is, which is one of the characteristics of professional nurse? So answers are: first one, participation in politics. uh, Second answer, reflective practice skills. Third, critical thinking capabilities. Fourth, communication and publication. So you know that there are several criteria to differentiate a profession from an occupation. So according to Miller, the characteristics of a professional nurse include educational background. If we take educational background, it should be college or university based education. And second, adherence to the code of ethics. You know, all know that we have our code of ethics for nurses. We usually use the American Nurses Association's code of ethics. And third, participate in a professional organization. Then continuing education and competency, communication and publication, autonomy and self-regulation, community service, use, development and evaluation of theory, and research involvement. This is one of the criteria used by Miller to differentiate a profession from an occupation. So, answer for the first question is answer D, communication and publication. Then move on to the second question. So, what's the question? Autonomy in nursing is part of challenges in achieving professionalization in nursing. Which statement best describes autonomy in nursing? So, what do you mean by autonomy? Autonomy is the ability to make their own decisions without being controlled by others. So, our given answers are: first one, acting in the best interest of others to contribute to the well-being of others. Second answer, remaining faithful to the ethical principles, keeping commitments and promises. Third, freedom to make decisions that affect oneself and to take decisions for oneself. Fourth, maintaining privacy of the patient and family and non-disclosure of their personal information. So, answer is answer C, or third answer, that is freedom to make decisions that affect oneself and to take decisions for oneself. Now we'll go to the third question. So the question is, which factor constitutes the diversity and disunity among nurses that leads to barrier in their professional development? So when we take barriers for professional development, there are two barriers for professional development. They are diversity and disunity among nurses and the work orientation of nurses. So when we take the disunity, examples for disunity and diversity among nurses include conflicts for positions due to different entry points. You know that in our Sri Lanka also, nurses will enter to the profession from different points. Most of the nurses, after their diploma, they enter to the profession, but some enter with the qualification of a degree, and some enter to the with the certificate of nursing. So because of these differentiations, conflicts may arise for positions. That is one factor affecting for disunity in the profession. Then second is conflicts of interest for nurses working in different disciplines. So some nurses works in clinical settings, some nurses work in community, some nurses work as educators. So there are conflicts between these nurses also that can be a factor affecting for disunity. Then third, different dimensions and standards of practice. And fourth, gap between nursing service and education. And fifth, the different professional bodies within the nursing profession. So among the given answers, what's the best answer? I think you can see what are the answers. First one, a large number of nurses are leaving the country for a more highly paid job in overseas. Second, nurses are looking for a better chance of advancement in in service or education in overseas. Third, nurses are not released by the hospitals to further their studies due to acute nursing shortage. Fourth, the existence of different professional bodies within the nursing profession representing their disciplines. So, the answer for the third question is answer D, the existence of different professional bodies within the nursing profession representing their disciplines. Then move on to the fourth question. It is believed that the public have misconceptions about nursing because they had received inadequate and inaccurate portrayal of nurses via mass media. Which is the best step the nurses should take in order to change the image of nursing? So, there are several images exist in the society about nursing. So according to Carella, there are 5 images of nursing. So these images are ministering angel, autonomous professional, subordinate professional, doctor's handmaiden is the most common and famous image, and domestic worker. So according to Black and Warner, there are 7 ways of promoting the image of nursing. So we see what are those strategies. First one, recognize that each of us must work to improve the image of nursing. Second, participate in professional organizations. Third, become politically active. Fourth, write to the local media on activities performed by nurses that contribute to improving societal health and well-being. Fifth, provide technical assistance to media. Sixth, take advantages of public speaking opportunities. Seventh, share positive aspects of nursing with others. So these are the things that we can do to promote the image of nursing. So among the given answers, what's the answer? So it's answer A, participate actively in any public speaking opportunities. So answer for the fourth question is answer A. Then we'll move on to the fifth question. In general, nursing is accepted as a profession that is more appropriate for the females. Which statement best describes this view? So answer A, the females are bearing and caring of children. B, the females are normally taking care of sick members in the family. C, the females are trained to be passive and play the subordinate role to the males. D, the females are gentle, soft and motherly, which is very much required during illness. So answer for the fifth question is answer B. The females are normally taking care of the sick members in the family. Then we'll go to the question number 6. Question is, which is the characteristic of empowerment? So what do you mean by empowerment? So empowerment simply means making someone powerful. So to describe empowerment, there are different theories used. So one of the theories, critical social theory. So according to critical social theory, empowerment is enabling those who are being oppressed to overcome, dominate. Another theory is social psychological theory. So according to this theory, empowerment is seen as a process of personal growth and development. So answer for the sixth question is answer C. It is associated with individual growth and development. Then move on to the seventh question. Question is, which is the positive aspect of using empowerment from organization and management perspective? So according to organization and management theories, empowerment is concerned with the distribution of power in organization. There are positive aspects of using empowerment from an organizational perspective. So these include trust in the work setting, reduced job strain and burnout, and positive effects of leader behavior, staffness, empowerment. So now the answer is clear. So answer for the seventh question is job strain and burnout are reduced. That is answer A. Question number 8. Which statement demonstrates the quality of personal integrity of an empowered nurse? If you can remember the theory, there are 5 qualities of an empowered nurse. Those are moral principles, personal integrity, expertise, future orientation, and sociability. Personal integrity is explained as looking after own well-being, dare to say and act both assertive and courageous, and able to act able to act under pressure, and broad-minded and flexible. So, answer for 8th question is assertive and able to act judiciously under pressure. That is answer D. Then move on to the question number 9. Question is, which is the best role in nursing leadership that helps in promoting empowerment? So, examples for promoting empowerment includes first one, a common nursing philosophy and general agreement on the outline of nursing. Second, respect for others in the unit. Third, leadership that gives opportunities for participation. Fourth, delegation of responsibilities by senior staff and placing confidence in subordinates regarding outcomes. Fifth, provision of information, optional training, reciprocal assistance, and teamwork to promote subordinates' confidence in delegated work. And sixth, conscious professional development to grow expertise. So now I think now the answer is clear. So answer for the question is answer B, delegate responsibilities and place confidence in subordinates. Question number 10. Nurses working at a psychiatric unit are generally seen empowered through personal growth and development that is influenced by their perceptions and milieu relationships. So, what is the explanation of social psychological theory on this connotation? So, earlier also we talk about social psychological theory. According to social psychological theory, empowerment is seen as a process of personal growth and development which is influenced by the individual's beliefs, values and perceptions and the relationship with the environment. Individuals who feel empowered from the understanding of social psychological theories have positive self-identity, the ability to extensively reflection their environment, and the ability to interact in the social environment appropriately. So, answer for the 10th question is answer A, extensive reflection by the nurses on environment. Then move on to the question number 11. Researchers has identified that empowerment are hindered by autocratic leadership. Which statement explains its rationale? So, by autocratic leaders, the empowerment is hindered because they are not trusting their subordinates. So the answer is answer D. The superior does not trust their workers. Participation and shared responsibilities are denied. So answer for the 11th question is answer D. Now move on to the 12th question. The question is, lack of empowerment in nursing affects nursing profession, organization and patient outcomes. What is the significant effect on the patient if they are not empowered? So when nurses have no power, they do not know how to empower their patients. When patients are empowered, they should be able to make their own decisions regarding their own health. When patients are not empowered, they lose their sense of control and self-efficacy, where patients are reluctant to assume responsibility for their own care. The care given in this situation would not be individualized because it would be based on nurses' own judgments. So this type of care results in poor patient outcome. So answer for the 12th question is answer D, have no sense of control and reluctant to resume responsibilities for their own self-care. Now we'll move on to the 13th question, which is the best description of autonomy from the perspective of nurses. So earlier also we discussed about autonomy. What is autonomy? So autonomy is the ability to make own decisions without being controlled by anyone else. So answer for 13th question is answer A, a nurse who is free from influence, control or determination from others. Now we'll move on to the question number 14. What should a nurse do in order to maintain the right and the safety of patient? So in order to maintain the right and safety of the patient, what should a nurse do? Answer A, possesses a valid license to practice. Answer B, gives due respect to the patient as an individual. Answer C, promotes health and safety within the community. Answer D, documents nursing actions and patient's progress appropriately. So answer is answer B, gives due respect to the patient as an individual. Question number 15. Which activity shows the significant authority of Malaysian Nursing Board? So if a profession has an autonomy, it should have its own regulatory body. So Malaysian Nursing Board is the regulatory body of nursing in Malaysia. So it has authority in handling test conditions for inclusion in the Register of Nurses Act 1950, Nurses Registration Regulation 1985 and Midwives Act 1966. Second, handling the registration of nurses, assistant nurses, community nurses, public health nurses, mental health nurses, midwives, Malaysian and overseas trained nurses and foreign nurses. Third, handling the registered midwives gazette. Fourth, issuing annual practice certificates to nurses or assistant nurses and community nurses and temporary certificates to foreign nurses. Fifth, issuing practicing certificates to registered midwives who practice obstetrics. Sixth, regulating the practice and control discipline of registered nurses and midwives. Next, acting as secretariat to meeting of the Malaysian Nursing Board and Midwives Board Malaysia. 8th, conducting activities for nursing professional development. 9th, handling the approval and accreditation of nursing and midwifery training programs. So answer for the 15th question is answer D, managing the accreditation of nursing and midwifery training programs. Question number 16. Which is the best strategy in enhancing professional autonomy in nursing? So to enhance professional autonomy, there are several things that we can do. First one, clarification on the nursing scope of practice. Second, the use of nursing process. Fourth, improving nursing education. And fourth, evidence-based practice. So according to the given answers, answer is B, improving nursing education. Question number 17. How does evidence-based practice contribute to the significant enhancement of professional autonomy in nursing? So you know that evidence-based practice means you use the research findings for the practice. The aim of evidence-based practice is to improve the quality of care to the patients. So answer is answer B for 17 questions, improving the quality of care to the patients. Question number 18. What is the most significant benefit of continuing professional development to nurses? So, continuing professional development, through continuing professional development, they can improve their knowledge and skills. So, nurses have opportunities to participate in activities that would ameliorate their knowledge and skills. So, answer is answer D for 18 question. Question number 19. What is the most common personal reaction from nurses relating to their reason for low undertaking continuing professional development? So when we take barriers for continuing professional development, those barriers include, there are three types of barriers actually: financial constraints, time constraints, and lack of support by employer, and the personal factors. If we take financial constraints, increased cost of continuous professional development activities and lack of personal funding are the factors associated with financial constraints. And when we take time constraints and lack of support by the employer, so you know that nurses need to go out of the workplace in order to get the in order to attend for the training of CPD activities. So the employer should release the employees. So the employees need the support of the employer. And personal factors include the attitudes towards CPD program. So if the nurses have lack of interest regarding CPD program, so it can be a personal factor for acting as a personal barrier for CPD activities. So answer is answer A, lack of interest. Low training budget is coming under financial constraints. Pressures of daily work coming under time constraints, and lack of support by the employer, and lack of financial support include financial constraints. So we'll move on to the last question. Question number 20. What should a nurse do to determine her learning needs for suitable continuing professional development activities? So to identify learning needs, you have to assess your learning needs and what is your goals, professional goals. So you have to do a self-evaluation and you have to determine your professional goals. So answer is answer C, conduct self-evaluation and determine professional goal. So I will stop here because we have less time. So the answers of the other questions are marked, and it is the paper is in the Moodle with the answers. So you can go through the questions and answers, and if you have any doubt or any clarifications, you can direct any of our academics. So thank you.